Good morning, ma'am. Is it audible, ma'am? Hello. Yes, good morning. Hello, am I audible? Hello. Hello. Hello.
Madam, you are not audible.
Hello. Yes, am I audible? Am I
Your
audible
voice is
now?
not clear, ma'am.
Hello.
Hello.
Yes,
Your voice is not clear, ma'am.
yes, now?
Okay, madam. Now it is audible.
Okay.
Okay, madam. We will start in 5 minutes, ma'am.
Sure, sure.
Good morning, one and all. Myself, Dr. Jilai Nas, first year PG scholar from the Department of Kaya Chikitsa, with the blessings of His Holiness of Sri Manipura Guru Mahanta Swamiji, on behalf of Department of PG Studies in Kaya Chikitsa, are organizing Manvantara 2022 National Webinar Series 2, Lecture 1. I welcome you all. Now I request Dr. Venkatesh Polampalli sir, Assistant Professor of Department of Kaya Chikitsa, for the welcome speech. Over to you, sir.
Good morning, everyone. I welcome you all on the platform of Manvantara second series. Today, we have our first guest lecture. So I welcome today's guest speaker, Dr. Ashwini Sajjanar Madam, Assistant Professor, Department of Rog Nidana, Shri DGM Ayurvedic Medical College, Gadag. The Madam is going to take a talk on the topic, the therapeutic domains of chronic kidney disease in Ayurveda. So I welcome you, Madam, on behalf of the Department of Kaya Chikitsa as well as SVM AMC, ILKAL. Thank you, and over to you.
Thank you, sir. Thank you so much. Good
Thank
morning,
you.
everyone.
Thank you, sir. Now I request Dr. Prabhu, first year PG scholar from the Department of Kaya, for brief introduction of our guest.
Thank you, Dr. Jalaninaj. Very good morning to all. It's my great opportunity to introduce today's honorable guest speaker, Dr. Ashwini Sajjanar Madam. Madam has completed her undergraduation from DGM Ayurvedic Medical College and Hospital, Gadag, in the year 2012. Madam has completed her post-graduation in Kaya Chikitsa department from DGM Ayurvedic Medical College and Hospital, Udupi, in the year 2017. Madam presently pursuing a PhD from Ayurveda Mahavidyalaya, Hubballi. Madam have a vast clinical experience, worked at Sita Bateja Hospital, Suguna Hospital, Punya Hospital, Global Hospital, Bangalore in the year 2012 and 13. Madam worked at Amruta Ayurveda Hospital at Ranebennuru and Sanjeevani Hospital, Davanagere. Madam has published 3 articles in international journals, 2 articles in national journals, 1 article in local Kannada language. Madam has presented many scientific papers. Madam is presently working as Assistant Professor, Department of Rog Nidana at DGM Ayurvedic Medical College and Hospital, Postgraduate Studies and Research Center, Gadag. Thank you, Madam. Over to Dr. Jalaninaj.
Thank you so much for welcoming.
Thank you, Dr. Prabhu. Now I request all the participants to mute. Now I request ma'am to continue the session. Over to you, ma'am.
Yes, thank you very much. Yes, am I audible? Shall I start?
Yes, ma'am, you are audible.
Yes. Okay. PPT is visible.
Yes, ma'am.
Good morning, everyone. First and foremost, with His holiness, blessings of holiness. I thank all the team members, organizing faculty of am I audible? Yes, I thank all the team members of organizing faculty of Shri Vijay Mantesh Ayurvedic Medical College and Postgraduate Research Center, ILKAL. And I'm feeling proud enough to be the first speaker in the Manvantara 2022 webinar series second, and it is organized by the Department of PG Studies in Kaichikitsa. So today I'm going to highlight regarding the topic therapeutic domains of chronic kidney disease in Ayurveda. So in present scenario, as we are observing that it has become the very burning issue regarding the systemic disorders. So we have passed over the pandemic COVID-19, which is having the vast impact on multi-organs. So like that, so it is one of the chronic kidney disease is also having this equivalent disaster, which is going to impact on the patient very seriously, and it is very important to diagnose it at the very early stage and to start the treatment accordingly. So as our science is mainly aimed regarding the eradication of the diseases and maintenance of the health. So what we call swasthasya swasthyarakshana, aturasya vikaraprashana. So this is the main motto of our science. So many acharyas have given contribution, unique explanation, unique contribution regarding many diseases. So in one among them, Mutrava Shoto Vikaras is also explained by all the authors or acharyas in our Ayurvedic science. So it is explained most of all the contexts, Brihatrahis and Lagutrahis. So it is having a vast explanation. So before understanding any disease, so we should have any vikruti. Before understanding any vikruti, so we should have the proper knowledge about the prakriti jnana. So hence it gives a clear picture to the diagnosis and as well as planning of the treatment accordingly. So here my main topic is therapeutic domains of CKD in Ayurveda. So what kind of treatment protocols we have to administer or we have to follow in the chronic kidney disease. So as in contemporary science, the treatment protocol is implemented based on the GFR rate. So it is in Ayurveda, it is completely different. So it is depending upon the stages. So that always we will apply the Vyadhi Pratyanika Chikitsa, right? So it is very apt to implement the treatment. So based on the diagnosis. So my presentation contents are as follows. First, introduction of the disease and approach to Mutrava Shotas, interrelated organs, and CKD, that is chronic kidney disease, Ayurvedic outlook, and chronic kidney disease, modern review. And Chikitsa Siddhanta for Vrik Roga and general treatment modalities of CKD and specific treatment modalities of CKD, and lastly at the conclusion. So let me start with the introduction. So as we know that chronic kidney disease, always it is having the broad spectrum of different pathophysiologic process. So it is mainly associated with the abnormal kidney function. So abnormal kidney function, it includes the parameters, that is renal function test. What we observe, that is urea, serum creatine, and the confirmatory, the accurate test, what we do in the CKD cases, that is GFR rate. So it is very important to analyze the pathophysiologic process in the CKD. So oliguria is one of the important cardinal feature of CKD. So in Ayurvedic classics, so Mutra Vikara is segregated. Again, it is segregated into two groups. So one is Mutra Ati Pravritti and Mutra Apravritti. So Mutra Ati Pravritti Janya Vikaras includes, that is all we know, that Vimshati Prameha. So Prameha is mainly characterized by the excessive frequency of micturition. And Mutra Apravritti Janya, so that is the oliguria or less micturition. So it includes the Vimshati Mutraghata. So Mutraghata is one of the context. We can take it as under the heading of CKD, that is chronic kidney disease. Almost the symptoms will match or mimics similar to the CKD. Among 20 Mutra Apravritti Vikaras, 13 are Mutraghata, 4 Mutrakrishna, and remaining 4 are Ashmari. So this is the classification of Mutra Vikaras in the Ayurvedic classics. So coming to the incidence of the CKD, so in India it is having the 7.85 million for every 1 billion population. And CKD is a chronic disease, and it is also called as a chronic clinical syndrome with multiple clinical entities. So always it is having the involvement of all the organs. So that is the surrounding structures related to the genitourinary system. So where in allied sciences, it has failed to prevent it in early stages. So always once the CKD is manifested, so in contemporary science, so it is the treatment protocol they will fix based on the GFR rate. But the proper, in our Ayurvedic classics, proper understanding of Nidana Panchakas will definitely help in early diagnosis, and also it is very important in preventive as well as in the curative management of the CKD. So first we'll see, just glance the Mutravashrotas. So how to approach to the Mutravashrotas, and what are the interrelated organs explained in the classics regarding the Mutravashrotas. So as I said that before understanding the Vikruti, so we have to know the proper knowledge of the Prakriti also. So which is normally the normal physiological function of the system. So we have to know that. So here first approach to the Mutravashrotas. So it is very beautifully explained by Acharya Vagbhata in Ashtangridaya Nidhana 9th chapter. So adhomukho api bastirhi mutravahi siramukhe pashvebhyaha puryate sukshmai syandam anai rana naratam yasya reva pravishenam doshaha kurvanti vimshitam mutragatan pramehascha krutram marma samashaya. So it is having the mode of manifestation. So the site of manifestation of the disease is adhomukha. So that is, it is related to the lower abdominal, and the involved structure is mainly basti. So along with the basti, so there are again other interrelated organs also, like Vruk, Gavini, Basti, and Mutravashrotas and Mutravadhamani, and also the Mutravasira and Mutravaha Nadi. So these are the structures which are involved in the manifestation of the Mutravaha Shoto Vikarans. And here Mutragata is main plays important role, which is having the 13 types of Mutragata, so which is having the different signs and symptoms and different clinical presentations. So this is explained in the Ashtanga Nidhana 9th chapter. So this is the explanation regarding the interrelated organs of Mutravashrotas. So it is also explained by Acharya Vagbhata and also Acharya Charaka in Siddhisthana 9th chapter 6th shloka. So this is also gives the clear picture regarding the structures which are the organs involved in the manifestation of the chronic kidney disease. So these are the organs involved in the manifestation of the disease: CKD, Vrik, Basti, Gavini, Mutravaha Dhamani, Mutravaha Sira, and Mutravaha Nadi. So what the Mutraghata refers to? So it is explained in the classics that Mutra Prisham Dukhena Mutra Pravritti. So it is mainly related to the dysuria and oliguria. So dysuria is nothing but the painful micturition, and the dukhena means here refers to the painful or the restricted or the cessation of the micturition. So that is a flow of urine. So the scanty less urine output is observed in the Mutraghata, and based on the different clinical presentations and different types of Mutraghata, again the signs and symptoms differ. So the main symptoms is the oliguria or the dysuria. So these are the shlokas which are explained regarding the types of Mutraghata. So coming to the just Ayurvedic outlook of CKD. So what we can go through or interpret regarding the chronic kidney disease in our science. So Acharya Vagbata has given a unique contribution of categorizing Mutrava Shotovikaras, that is into two types, as I already explained, that Mutra Ati Pravritti and Mutra Apravritti Vikara. So Mutra Ati Pravritti Vikara like Prameha, and Mutra Apravritti Vikara Ashmari, Mritrakrucha and Mutraghata. So symptoms of both this Mutrakrucha and Mutraghata. So here the Mutrakrucha and Mutraghata, so the conditions will similar or overlap. So as to avoid confusion, so Acharyas, Dallana, Chakrapani and Vijay Rakshita, so these Acharyas have demarcated the both entities. So the basic difference regarding the conditions, that is Mutraghata and Mutrakrucha, so there is an intensity of the obstruction. So in the Mutrakrucha also there is an obstruction of the urine, and in Mutraghata also there is obstruction of the urine. But the difference is intensity. Intensity means the frequency or the severity. So how much the obstruction is. So this is the obstruction of the urine. So this will be analyzed, assessed in the contemporary science based on the GFR rate. So this is the main difference between the Mutrakrucha and Mutraghata. So as it is explained in by Dallana, Chakrapani and Vijay Rakshita Acharyas. So that is Vibandha or Avarodha. So it is a obstruction, that is it is termed as a Vibandha or Avarodha, that is Mutra Vibandha or Mutra Avarodha. So this is just a differentiation between the Mutrakrucha and Mutraghata. So next is Mutravaha Shotodushti Nidana. Coming to the Nidana. So what are the causative factors for the manifestation of the chronic kidney disease in Ayurveda? So it is very important to know the etiological factors. So before going to the treatment protocol, it is very important to diagnose the disease properly at the early stage. So hence here coming to the Nidana of Mutrava Shotodushti Nidhanas, first is Udaka Sevana, so that is excessive drinking of water, Bhaksha Sevana, having food, excessive intake of food, Stri Sevana, that is during urge for micturition, Mutra Nigraha, suppression of the urges for micturition, and suppression of the micturition, particularly when wasted and when wounded. So during the disease condition or during the illness, so if the Vega Dharana, so that is a Mutra Vega Dharana, if it is suppressed, then it affects the urinary system. So these are the just gross Nidhanas, causative factors for the Mutrava Shotodushti. So Nidana is already it is explained in the context, that is by the Madhukosha. So according to the treatment point of view, so the knowledge of Nidana is very important, because the first principle of the treatment always we follow is the Nidana Parivarchana. So without knowing the positive factors, so if you give any kind of treatment, so whether it is a Shodhana, Shamana, Brahmana, Rasayana, so that is after having no results, or it might be having the less results. So it is very important to go for the Nidana Parivarjana before planning any kind of the treatment protocol. So all the Nidhanas which come under 3 headings, that is Prajnaparada, Satmendriya, Indriyartha Sanyoga and Parinam. So these are in different ways according to one way. So the Nidhanas may be divided into 2 types, Samanya and Vishesha. So all the diseases which are explained in the Ayurvedic classics, almost all the diseases will be having the Samanya Nidana as well as Vishesha Nidana based on the types of diseases. So here according to Ashtanga Hridayakara, that is according to Vagbata, Mutra Shoto Vikaras are considered into 2 categories, as we discussed, Ati Pravritti Janya and Mutra Apravritti Janya. So here there is a 13 types of Mutra Vata are explained in the context. So there is a important factor to know which is the main factor involved in the manifestation of the Mutrava Shotovikara. So here it is related to the site of manifestation, that is Adhomukha. So in Adhomukha, mainly the Apana Vayu is get vitiated. So if Apana Vata is get vitiated, it causes severe diseases of the urinary bladder. So when Vayu is favorable in bladder, urine is excreted properly, right? So, but when it is in the opposite direction, so various disorders will appear. So like in that, among those disorders, Mutravata is one among that. And along with this, Prameha, Shukradushti and Mutra Vikritis. So these all diseases, all conditions are located in the bladder. So these conditions should be avoided if the Apana Vata is functioning or favorable in the bladder. So it is very important to maintain the or to avoid the vitiation of the Apana Vata. So coming to the Mutrava Shotas, Nidhana, Shotodushti Nidhana in detail. So here Mutritodaka, Bhakshana and Stri Sevana. So why it is lead to the person end up with the severe disorders like Mutravata? So because here faulty habits. So the person, he follows the faulty habits or the Nidhana like Mutritodaka, Bhakshana and Stri Sevana. So that is the food or indulging in sexual intercourse by a person during the urge for micturition. So this is very important factor to prevent or to provoke the Vata dosha. So Vega Dharana and indulging in activity. So these both entities will lead to the provocation of the Vata dosha, especially the Apana Vata, and that too Mutra Vega Dharana and act of sex or consuming food will provoke the Apana Vata. So these Nidhana will directly leads to the provocation of the Apana Vata, and that leads to the diseases related to the Mutravaha Shotas. And second is Mutra Vega Dharana. So it is an important factor. The Apana Vata is again it is situated in the pelvic region. So if you suppress the urge of micturition, so directly it is affecting the excretion of the urine, and also it is affecting the basti, that is the bladder. So the any impairment in its function, so that is any disturbance, or it is Pratiloma Gati or any obstruction in the region, pelvic cavity, so it leads to the affliction of Mutravaha Shotovikaras like Mutraghata, Prameha, Ashmari and etc. So all the conditions will which cause the pratihanyate, what we call it as a obstruction to the Mutra Vegas. So it leads to the 13 types of Mutra Ghata and also have the similar effect over the Mutra Shotas. So Vigunagati, one more word here Acharyas use for the Pratiloma Gati is Vigunagati. So it is understanding of in contemporary science, we can understand it as a vesico-uretral reflex. So this is the similar, the presentation or the pathological function in the contemporary science. So vesicoureteral reflex. So this is main factor to for the initiation of apanavata in pelvic region. So next is ruksha madhya sevana tikshna aushadha prasanga nitya prushtayana, and due to intake of anupamatsya, adeshana and ajirna. So these are the main factors, main etiological factors which leads to the manifestation of the mutra krishna or mutrava shoto vikaras. So kshinasya Kshina Purusha. So that is a Kshina Purusha, how he is susceptible to develop the Mutrava Shota Vikaras. Here Kshina refers to Kshina Kaya, that is Bala Kshina. Bala is of two kinds. Again we know that Bala refers to the physique of an individual that is obtained by the physical exercise, that is Vyayama, and Abhyantara Bala, which is like what we call it as ojas. So in the present context, in CKD or in the Mutraghata, Bala should be considered as Abhyantara Bala, and the different factors which are responsible or which are attributed for the Balahina or Durbala, they are Swabhava, Dosha and Jara. So these three factors relates to the genetic factors. Swabhava is refers to genetic factors. It means that CKD may be genetic disease, or it may be by the due to the lifestyle or environmental factors also, and it may be caused due to the Jara, that is geriatric issues. Next is Sabikshata. So the person who is suffering with the injuries, so the multiple organ injuries, so in injury to the organs, when it happens, so when the person is suffering with the specific systemic diseases, so suppose the diabetic patients, so if the sugar levels are not controlled, so directly it leads to the diabetic nephropathy. So in later stages, person will end up with the nephropathy, so that again it causes the diseases related to the Mutravashotas. So like that, any organ injury will directly leads to the particularly the specific systemic disorders. No doubt that the person will end up with the Mutragata and related complaints, and the bladder distension or urine retention. So such signs and symptoms will be observed in the patient who is suffering with the injury to the organs. So in classics, in our Ayurvedic classics, the Mutra Krishna Nidhana, Shota Nidhana, Mutraghata Nidhana. So all these are separately discussed. Why? Because so there are interrelation between the Shota, Mutraghata and Mutra Krishna in according to the chronic kidney disease. So as we observe the signs and symptoms or clinical presentation of the chronic kidney disease, so almost it mimics one or the other way in all three conditions. So first is the Mutra Krishna Nidhana. So here Mutra Krishna Nidhana includes Vyayama, Tikshna Aushadha, Ruksha Madhya Sevana, Prasanga Nitya, Prishtayana due to intake of Anupamatsya, Adeshana and Ajirna. So why these will cause the Mutra Krishna? So that is Mutra Krishna is again here there is an obstruction of urine, but here Ati Vyayama is again the excessive amount of exercise. So why it results in the Mutragata? So why it results in the Mutra Krishna? So the Ati Vyayama leads to Kshaya. So Kshaya leads to again the other disorders like Kshaya, Pratamaka Shwasa, Rakta Pitta, Chardi, Atisara. So all these conditions will be having the Nidhana Ati Vyayama. So here the person who is doing excess work beyond his capacity, then he may undergo the severe dehydration, electrolyte imbalance, and lactic acidosis. So these three pathological processes will take place by the Kshaya and Shoshana of Jaliya Dhatu. So what we call it as the electrolyte imbalance. So the water absorption will be reduced in the body, and that will leads to the Vata Prakopa, and that Vata Prakopa is responsible for the manifestation of the Mutraghata. So that is fluid and electrolyte imbalance may lead to the pre-renal failure. Next is Tikshna Aushadha. So Tikshna Aushadha Dravyas, it is characterized into two types, that is Bheshaja and Abheshaja. So Bheshaja is the dosage of a drug. So that is determined based on the Dravya Guna and Karma. So this is always, we know that it is a basic information to plan the treatment protocol. So any diseases, so we have to take the proper information from the patient, whether patient is allergic to any sort of drugs or any sort of dravyas. So that is the ahara dravyas or aushadhi dravyas. So the adverse drug reactions or multiple drug reactions is observed in the patient before giving any shamana aushadhis. So Tikshna Aushadha, so that is in contemporary science, there are some drugs which leads to the nephrotoxicity. So those drugs will also taken by the patient. If the patient is taking regularly or in excessive quantity of the nephrotoxic drugs, so that you have to observe in the patient, and that you have to advise the patient to stop those medications. So Nidana Parivarjana again plays important role in this condition. So CKD is manifested, maybe there may be chances of manifestation of the CKD that is drug induced also. So Tikshna Aushadhas should be avoided in this particular condition. Next is there is a relationship between the Bheshaja and Abheshaja kind of relation in CKD. So that is Abheshaja is related to the Bhadana and Sanubhadana. So that is explained. It is explained in the Bhava Prakasha related to the Mudragata. So here the effects of Abheshaja like Visha, Shastra, Agni, and Ashani. So like Visha Dravya, it may bring the Sagnya Nasha. So when the person is exposed or the person is having the effect of Visha, that is poison, so person may end up with the unconscious stage, and like Shastra, that is any armament, so that is the Shastra Dravya may bring about Marmacheda. So that is it destructs the vital organs, and like Agni. So Agni here, it brings the spota, that is blisters on the skin. Ashini means that is the lightning and thunder god, so which may result in the Sajvanashka, so that is imminent death. So these Abheshaja, relation between Abheshaja and CKD is explained by the Bhava Prakasha and also in the Vaishaja Ratnavali and Rasatani. So these are the simple nidhana for the Mutra Krishna. And next is Ruksha Madhya Prasanga. So due to excess intake of Ruksha variety of Madhya, which leads to the Mutra Krishna. So again, Vata Prakopa plays important role here. And due to intake of Anupa Matsya and the Adeshana and Ajenashana. So these also leads to the Vata Prakopa. And here the Anupa Desha, so which refers to the marshy areas. So the heavy rainfall is a characteristic features of that particular area, and the Vagbata explains here that Matsya are Parama Kapha Karaka. So when there is a Kapha Pradhana dosha, when Kapha increases, again it leads to the Avarana, or it increases the Kledatva in dosha dhatu and Mala and Shotas. So due to excessive Kledatva, so it leads to the Abhishandi guna, the increase in the Abhishandi properties, and which causes the Shotoroga. So these favorable conditions in the various body parts which leads to the various diseases of the Mutravaha Shotas. And coming to the Shota Nidhana. So here Shota is one of the characteristic feature of Rukroga. So Nidhanas of the Shota will be incorporated as a Nidhana of Vrukroga. So here, first one is Nitya Prayoga of Panchakarma, Samsarjana Krama, Nitya Prayoga, due to the diseases also Kushta, Kandu, Pidaka, and due to Vega Avaroda of Chardi, Shavatu, Udgara, Shupra, Apanavayu, Mutra Purisha, Vega Dharana, Ati Guru, Lavana, Pichila, Anna Sevana, Phala, Shaka, Madhya, and Brudvika Sevana, Garbha Sampedana, Garbha Prapatana, Sadhya Prajana, and Marmagata. So these are very important factors for the manifestation of the Shota. So knowing the diseases, so that is the renal disorders, that is what we call Rikkaroga according to Ayurveda. So these factors will play the main role in the manifestation of the Rikkaroga. So next, Mutraghata Nidhana. So Mutraghata Nidhana, again here there is no specific quotation related to the Nidhana of Mutraghata, but if we study all the 13 types of Mutraghata, so Mutra Vegadharana and Tridosha, Dushana, Ahara and Vihara are the main positive factors which observed in the classics. And in the Shushruta Samhita, Dallana and in Madhava Nidhana, Madhavakara defined Mutraghata as a obstruction to the passage of urine. So in later stages, so once the disease is manifested, in later stages, the kidneys are damaged, secretion of the urine will be affected. So when the kidneys will get damaged, the urine output will be reduced and that results in the oliguria. So this depends upon the dominant dosha. Based on the dominant dosha, the classification of Mutraghata is explained in the Ayurvedic context. So first we will see what are the Mutraghata types based on the dominance of Vata. So first is Vata Baspi, Vata Shrila, Vata Kundalika, Mutra Rita, Mutra Jatara, Mutra Sangha, Mutra Granthi, Mutra Shukra, Vidvighata, and Basti Kundala. So Vataja type of Basti Kundala. So these conditions will be having the dominance of Vata, and thus only Vata dominant will be seen in these conditions. And the dominance of Vata and Pitta. So both Vata and Pitta will be dominated in conditions like Ushna Vata, Mutra Kshaya, Pittaja variety of Basti Kundala, and Pittaja variety of Mutrokasada and Mutra Avasada. And coming to the dominance of Kapha, Kaphaja type of Basti Kundala, Kaphaja type of Mutrokasada. So these two conditions will be having the purely dominance of the Kapha dosha. So Mutraghata is classified based on the dominant doshas we discussed here. So coming to the differential diagnosis. So how we have to diagnose or how we have to make the differential diagnosis of Mutraghata. So there are some parameters to assess. First is, as we discussed in the introduction, that rate intensity of the obstruction. So intensity of the obstruction is one of the differentiating factor between Mutrakritsha and Mutraghata. So in general, comparing with the contemporary science, Mutraghata can be correlated with the obstructive uropathy and Mutrakritsha can be taken as a dysuria. So here in Mutraghata, so the obstruction, suppression of the micturition will be more predominant. But in Mutrakritsha, dysuria and the dietic causes will be more predominant. So always the obstruction is more in the Mutraghata comparatively in the Mutrakritsha, and also dietic causes will be more in Mutrakritsha compared to Mutraghata. So it means that suppression of the micturition will be more in the Mutraghata and less in the Mutrakritsha. So this is the differential diagnosis of Mutraghata and Mutrakritsha. So Mutraghata, again, the varieties, various categories will be classified based on the pathogenesis. So first is the suppression of the formation of urine, that is Mutra Kshaya. Second is abnormalities of the urine. So that is the color and the consistency of the urine should be assessed. Third, increased and vitiated vata with functional changes. And fourth is increased and vitiated vata with structural changes. So structural changes means here there may be the structural defects in the urinary system. So for example, there may be distension of the bladder, or the bladder contraction and sphincter relaxation will be hampered, or there is any stenosis of the bladder sphincter, and the bladder tonicity may be seen, and there may be the urethral stricture and rectovesical or the rectourethral fistula may be formed, and congenital anomalies may also present in the person related to the urinary tract, and iatrogenic diseases. So that is the injury or the surgical procedures. So that is unskilled surgical procedures or injuries to the vital organs directly to the urinary system, that may also leads to the manifestation of the Mutravaha Shrotovikarans, and the secondary infections and malignancies. So these all are very important pathological conditions which are related to the chronic kidney disease. So coming to the modern review. So modern review, again, the chronic kidney disease is having the spectrum of different pathophysiological processes associated with the abnormal kidney functions. So here the progressive decline in the glomerular filtration rate, that is GFR. So based on the guidelines of National Kidney Foundation, kidney dialysis outcomes quality initiative, stages of CKD are defined according to the estimated GFR. So that is eGFR is calculated based on the stages. So this is the tabular column which represents the description of the parameters and the GFR and action plan. So what will be the prediction of the treatment? So what will be the action plan for the particular description of the kidney failure? First one is kidney damage with normal GFR, that is more than 90. So the diagnosis and treatment of comorbid conditions, slowing progression and cardiovascular death risk reduction. So even though the patient is diagnosed with a CKD, but there is a normal GFR, so GFR is more than 90, then it should be managed, or it should be treated with a regular follow-up so as to maintain the comorbid conditions. So comorbid conditions should be controlled, and which indirectly affects or which indirectly makes the progression or the slowing process of the progression of the CKD. And if we slow down the process of progression, then automatically the risk reduction of CVD will also be reduced. Second point is kidney damage with mild decreased GFR. That is, GFR should be the between 60 to 80. So then estimating progression. So we have to analyze how much the progression of the disease takes place. So that is the estimation of the progression of the condition. Third point is moderately decreased GFR. GFR will be 30 to 59. So in this stage, evaluating and creating complications. So the action plan should be evaluation and of the condition, signs and symptoms, and also the creatine levels should be monitored. Severely decreased GFR, that is, GFR will be between 15 to 29. So in this condition, preparation of the kidney replacement therapy. So that is dialysis or the kidney transplantation should be planned. And last is ESRD. So that is end stage renal disease. The GFR will be less than 50, then replacement of the organ will become compulsory to save the life of the patient. Coming to the Chikitsa aspect. So So treatment modalities in CKD in Ayurveda. So in Vaishyaja Ratnavali, so 93rd chapter, so it is quoted that Adau tu Vishaja Karyam Vicharyeka Vidhanatah Rakta Samhokshanam Rogi Roga Yostau Balabalam Tato Virekaha Svedascha Tataha Mutralam Uttamam Rakta Samshodhanam Pushtikritam Agni Bala Vardhanam. So here the in context of Vruk Roga, that is chronic disorders like Vruk Roga, Shota, Udara. So the physician should always think about the Rogi Bala. So as there is a special type of Rakta Vikruti in the Vruk Roga, so the following line of treatment should be followed. So that is the in Shloka it is said that Rakta Mokshana. So that is Rakta Mokshana, Virechana, Svedhana and Mutrala drugs. And lastly the Rakta Samshodhana and Rakta Pushti Chikitsa and Agni Balavardhana Chikitsa. So these treatment modalities are implemented in the Vruk Roga and in Shota and Udara kind of severe or chronic conditions according to Vaishyaja Ratnavali. So general line of treatment to be followed, that is Mehana, Svedana, Snigdha Virechana, Basti and Uttara Basti. So treatment modalities which are explained in the science classical text. So that is Nidhana Parivarjana will be the first line of treatment. Next coming to the Shodhana. So in Shodhana, Virechana is indicated in the Vrik Roga. And third is Shamana. So that is the Mutrala Dravyas and the Rakta Prasadana and the Balavardhana, Agnivardhana, Chikitsa Dravyas will be given. And Rakta Mokshana and Svedana. So these are the treatment modalities explained in the Vrik Roga in general. So specific line of treatment in CKD we can adopt according to the classical explanation. So three conditions we have taken here for the correlation of the CKD in Ayurveda. So the signs and symptoms will mimic similar to these conditions. So that is Mutraghata Chikitsa, Rakta Pitta Chikitsa, Shota Chikitsa, Shonita Abhishanda Chikitsa, Rakta Dushti Chikitsa and Asadhya Pandi Chikitsa. So these conditions, these chikitsa or the specific mode of treatment to be adopted based on the Rogi Bala as well as based on the clinical presentations of the condition. First one is Rakta Mokshana. So it is told as the first line of treatment. So if it is the Rogi Bala is Pravara, otherwise it is not to be adopted. So in contemporary science, it is highly unacceptable. So that is as in CKD, there will be less production of erythropoietin hormone. So which leads to the less erythropoiesis. So, but if the patient is having the Pravara Bala, so then we can go for the Rakta Mokshana kind of treatment. But along with that, the blood parameters should be assessed to avoid the impairment or in the erythropoietin hormone production and the less erythropoiesis. So this is to be monitored carefully while the Shodhana therapies or like the treatments like Rakta Mokshana is implemented. Next is Virechana. So it is a second therapy which is explained in the classical text. So that is, it is explained in almost all Vaishyaja Ratnavali, Bhav Prakasha, Chakradatta, Vangasena and Ashtanga Hridaya and also in Charaka. So it is explained in almost all the context regarding the second therapy in the sequence of Panchakarma, which is widely used as a Shodhana procedure, especially for the Paitika Badis. So if there is, it is useful in the disorders which is associated with the Pitta, associated with Vata or Kapha. So it is again explained as a less tedious procedure than the Vamana Karma, and hence the possibility of complications and it could be done easily. Hence, this is very much widely practiced Shodhana Karma in routine clinical practice. So in general in Vruk Roga, so as we see the Samprapti, so Samprapti of Vruk Roga. So here it is explained that first the Nidhana, so which leads to the vitiation of Mutravaha and Medava Shotas. So further it leads to the Vikriti in the formation of Prakrita Mutra. Then it leads to the less excretion of urine from the body, which affects or which hampers the Kleda Vahana Karma in the body. So this excess Kleda in the body will leads to the vitiation of Vata in the Basti, especially the Apana Vayu is affected and it takes the Pratiloma Gati as Vata takes Sthana Samshaya in the Vruk or in Bhotava Shotas. So then finally, after all this pathological process, the person will end up with the Mutragata and other diseases also related to the Mutrava Shotas, that is Prameha, Mutra Dosha and the Rakta Pitta. So that the person will end up with the Vruk Roga in general. So this is the general Samprapti of Vruk Roga. But where we have will observe the Adhisthana of Vruk Roga here. So that is Vruk and Basti is mainly affected. So the treatment aspect will be having more the Samprapti Vikatana Chikitsa. So always it is better to opt for the Samprapti Vikatana Chikitsa. So in Samprapti of Vruk Roga, all the three doshas take active participation and they have same can be appreciated by the clinical features. So here the Samana Vata and Apana Vata should be considered. So that is Samana Vata moves like in the entire koshta. So here in this condition in Vruk Roga, so it is mainly responsible for the total digestive process and also the separation and forwarding of the Pitta Bhava. So Apana Vata is responsible for excretion of Mala Mutra Shukra Artava. So like this. So when Apana Vata is get vitiated, then again directly it affects the Mutrava Shotas and there it the normal expression of the Mutra will not be takes place. So it is one of the responsible factor for the manifestation of the chronic kidney disease or we can consider as a Mutra Ghata. So in the Samprapti, so related to the Vata is plays important role in the manifestation of the disease and also it is treated accordingly. So Pitta, the involvement of the Pitta directly it may not be there, but due to Nidhana Sevana, Pitta can be aggravated and along with the aggravated Pitta may reach the Vruk Basti or along with Vata Dosha. So that will influence the Kapha Dosha also. So once Vata is vitiated, along with that, the Pitta and Kapha may be influenced and they may involved in the manifestation of the Vruk Roga. So here role of Kapha Dosha is very very apt or very important presence, shows important presence in the Samprapti of Vruk Roga. So in general, not specifying to the Mutra Vata, Mutra Pushra, Mutra Kasada. So in general, when we take the Vruk Roga as a whole, so there is a dosha is having the where Kapha Dosha is having very plays important role in the manifestation of the disease because it is having the synonym as a kleda. So kapha means it is having the increased kleda and that excessive kleda will leads to the manifestation of the Vruk Roga. And in other way, we can take it as a kapha dosha which is reached the Vruk and Basti. So that will be having the influenced by the contrasting. So that is the properties which are contrasting of Vata and Pitta dosha. So again, as a whole, Vata, Pitta, Kapha, all the three doshas will be having role in the manifestation of the Vruk Roga. And coming to the Dusha, so in Samprapti Gatakas, Dusha is also very important. So Mutra, Rasa and Rakta. So these three Dushas will be considered in the formation of Vruk Roga. So that is Mutra is one of the, again we know that it is one of the Trimala and it helps not only in the maintaining the normal body temperature but also elimination of Kledatva of body which helps in Dharana Karma. So the Ruk Roga is concluded as a Tridoshaja Vyadi. Almost all it affects all the dhatus, and overall Mutra and Rakta commonly affected doshas in the Ruk Roga. Coming to Agni, so we state that commonly that is Rogaha Sarve Api Mandago. So it means that almost all the diseases or Roga will be caused due to the Jataragni Mandata, even though Jataragni may not actively involved, but it is having indirect role in the Samprapti. Ama here, next coming to the Ama. So obviously when there is a Agni Mandya, so next there will be involvement of the Ama, that is Jataragni Mandya Janya Ama and Dakagni Mandya Janya Ama, which supporting indirectly in the formation of Ruk Roga. Coming to the Shotas, so obviously the Mutrava Shotas is affected and it is having the utmost role in the manifestation of the Ruk Roga and the Shotodushti Prakara. So already we discussed that is the Vibhanda or Avarodha. So there is Sangha and Vimarga Gamana. So there will be obstruction and also the opposite direction of the doshas. So this will have influenced the Shotodushti Prakara, that is Sangha and Vimarga Gamana. Next, Udbhava Sthana is obviously the Pakvashaya, which is considered as the Udbhava Sthana of Ruk Roga. It is one in which there the Mutra formation takes place and later it is drained into the Baspi through Mutravaha Nadi. Next, coming to the Sanchara Sthana. So Sanchara Sthana is again here initiation of Mutravaha, Rasavaha and Raktavaha Shotas. So that is these three will be having the Sanchara Sthana. So the Ruk Roga, Mutra by initiated doshas takes place in the Mutrava Shotas and vitiates all other Shotas. So this is based on the Samprapti. Here in Ruk Roga, the patient having the Agni Bala, patient's Agni Bala and Sharirika Bala will be comparatively very less. So always in such conditions, so patient, we can't plan the classical Virechana. So before performing any type of Shodhana, so that is, we have to assess the Rogi Bala and the Roga Bala here. So because in classical Virechana, we have to plan the Snehapana and that is in the increasing order. So because if patient is not having proper Agni Bala and Sharira Bala, so it is very difficult to adopt Snehapana or to adopt classical Virechana, as it may worsen the condition of the patient. So in patients who is having less Agni Bala and Sharira Bala, better most to avoid the classical Virechana, and we can go for the Sadhya Virechana instead of following the classical Virechana. Even according to contemporary science, there will be dyslipidemia in CKD patients. So that is due to delayed catabolism of the triglycerides. So it is very most factor which is observed in CKD patients. We have to monitor the lipid profile also for the condition of the knowing the condition like dyslipidemia, and it is better to monitor regularly or in the based on the signs and symptoms of the patient. But at the same time, for the better absorption of the Aushadha, so that is Mala Anulovana and Shoto Shodatva is very essential. So always we have to, Shoto Shodatva is very essential, and by considering all these factors, it is better to plan the treatment with the Deepana Pachana and the Koshta Shodhana. So this is the initial treatment. So we have to plan the treatment with the basic basic factors like Deepana, Pachana and Koshta Shodhana is essential before planning any treatment. So there are some treatment modalities. So that is basti are advised in CKD. So these are the list of bastis which are indicated, directly indicated in Mutragata, Basti Graha, Mutra Kritra, Ashwari, Mutroka Sada. So all these, and also some of the bastis will be having directly indicated in the Rakta Pitta and Shota. So that is, first one is Chandanadi Niroha Basti, Kushadi Panchamula Niroha Basti, Kafaroga Nashaka Niroha Basti, Mustadiyapana Basti, Mutra Kritra Nashana Niroha Basti, Kshara Basti, Swadamshadi Pancha Prasvatika Basti, Punarnavadi Niroha Basti. So these are the different bastis which are having the direct reference for the treatment of Mutra Gata, Shota and the Mutra Kritra. Next, coming to the Swedana. So Niragni Sweda, which is having the qualities of the Niragni Sweda, which plays an important role and which is prepared without using fire. So that's why it is indicated in the Meda Kapha Avarana conditions. So in CKD also there is a Avarana of Vata Avarana. So that is also important factor, and it is important pathology which is having the important role in the planning treatment protocol. So here the Vata Avarana, so that is takes place in the CKD. So in that conditions, these Niragni Sweda can be given and it can be adopted. And Svedana is also indicated in Shota, and it is one of the chief complaints in the Vrukroga. So in the Vrukroga, Shota will be seen, and the Svedana is indicated in Shota. So Svedana is planned or considered for the treatment modality. And coming to the Mutrala Dravyas. So Mutrala Dravyas like Mutra Sangrahaniya, Mutra Virechaniya, Mutra Virajaniya, Ashmarigna, Rakta Samshodhana, Rakta Pushti, Shonita Stapana Gana, Agni Vardhana Chikitsa and Balavardhana Chikitsa, that is by Balya Gana Dravyas. So these Dravyas can be taken as a Shamanam Shadis for the in the treatment modality of the CKD. So some of the yogas are indicated in CKD. So first one is it is having these all yogas are having the direct indication of Mutra Gata, Mutra Kritra, Shota, Rakta Pitta or Basti Graha, so Vrukroga. So such indications are given in the classics. So first one is Trina Panchamola Kvata. So it is explained in Vaishyaja Ratnavali. So here the dosage, the 50 ml Kvata along with honey. So that is indicated in the Pitta Krutra, that is Paitika type of Mutra Krutra, Basti Vishodhana, that is cleansing the urinary bladder. So it is very plays important role in these two conditions. And Gokshura Kvata. So here the Gokshura again it is having the property of Mutrala. So it is helpful in the dysuria caused by the obstruction in the urinary passage by the lumps of stool. So it the pressure from the colon. So that is the Gokshura Kvata will be helpful in the obstructive pathology of the urinary disorders. Next is Brihatyadi Kvata. So it is explained in Vaishyaja Ratnavali and also in the Chakradatta. So it is indicated in the Pittaja Shula. So here all the ingredients like Brihati, Gokshura, Eranda, Kusha, Kasha, Ikshuralika. So all these ingredients are taken in equal parts, and the 400 ml till its original quantity is reduced to 1/4, and that should be used for the internal administration. Next, Punarnavashtaka Vata. So this is indicated in Sarvanga Shota, Udara Roga, dyspnea and anemia. So anemia is again the one of the clinical presentation in the CKD. Punarnavadi Vata. It is having the indication in almost all types of Shota and GIT diseases, cough, Shwasa, Shula and Pandu. So it is useful, it is having the beneficial action in the CKD. Next, Haritikyadi Kvata. It is explained by Bhaishya Ratnavali and Yoga Ratnakara. So it is also having the therapeutic benefits in Shota and Udara Roga. Dashamuladi Kvata, it is having the direct benefits or direct indication in Jalodhara, Shota, Galaganda and Vata Roga. Punarnavadi Kvata, so it is having indication in Vidradi. So here also in CKD may be having one of the clinical presentation that is in the Abhyantara Vidradi. So here we can take it as a Abhyantara Vidradi means so any abscess or any the formation of the inflammation. So like pyelonephritis. So pyelonephritis we can take it as a Abhyantara Vidradi. So in such conditions, the Punarnavadi Kvata will be beneficial. Varunadi Kvata. So Varunadi Kvata is having the, again it is indicated in the Abhyantara Vidradi. Gokshura Kvata. So Gokshura Kvata is again indicated in the Mutra Kruchna. Gokshura Kvata is explained in both Vaishaja Ratnavali and also in the Yoga Ratnakara. So it is having both indication Mutra Kruchna and Mutra Gata. Next, Trikanta Kadyabrata. So Trikantaka means here Gokshura. Again, it is explained by Vaishaja Ratnavali, having direct indication in the Mutra Krishna, Ashmari and Mutra Gata. Trikanta Kadikwata, indication Ashmari and Mutra Krishna. And some of the research updates. So before going to research updates, we can conclude that here Mutra Kshaya, Mutra Gata, Mutra Krishna, how we can implement in the Ayurvedic classics. So first one is due to the hypertension. So it is a risk factor for the CKD again, and also in CKD the person will be having the malignant hypertension that we can be correlate with the Shonikabhishanda. And in CKD patients there may be chances of having the hyperuricemia. So that is uric acid will be increased. So that can be taken under the heading of Asadhya Vatarakta. And AMA, so AMAja conditions can be taken as a amyloidosis, and Abhyantara Vidradi can be taken as a pyelonephritis and Raktaja Mutra Kruchna. So if the patient is having hematuria and a severe less urine output, then it can be taken under the heading of renal tuberculosis. And Shota, obviously it can taken under the renal edema and Asadhya Pandu. So in CKD patients, anemia is most common presentation. So it can be taken in under the heading of Asadhya Pandu and Sannipataja Chardi. Because the CKD patients, when the blood urea is increased, that will induce the vomiting in the patient. So uremic vomiting can be taken as a Sannipataja Chardi. So this is the brief explanation regarding the therapeutic domains of Rit Roga, that is CKD in Ayurveda. So coming to research updates. So some of the research, clinical researches have been carried out in the chronic renal failure. So this is the research study, that is clinical comparative study in the management of chronic renal failure with the Punarnavadi compound. So Punarnava, again, it is a Motrala drug. So it is having the good benefits or good result in the chronic renal failure. Next, effects of Ayurvedic treatment. So among 100 patients of chronic renal failure, so Ayurvedic treatment is given here. So the Niruha Basti of Punarnavadi Kvata, and along with oral medications like Kokshuradi Gugulu, Rasayana Churna and Varunadi Kvata. So this is also having the significant result in diabetic nephropathy. So that is this kind of treatment will be helpful in CRF, which is of the origin of systemic diseases. Next, Ayurvedic management of chronic kidney disease. It is a case study done in the SKM AMCH in Bangalore. So that is the condition. So that is chronic kidney disease. It is treated with the administration of Haritaki and Shunti along with Chandra Prabhavati. So Anupana is here taken as a buttermilk, and this is having the significant result in the chronic kidney disease. So that is this kind of treatment will also help in the CKD. So these are the some research updates. And coming to the conclusion, so let me conclude my topic with the understanding of CKD in Ayurveda is based on multitudes of etiology. So as we discussed all Nidana Panchakas and Chikitsa Siddhanta of Rukroga, so it is very important to understand CKD in Ayurveda based on the etiology and the vast clinical spectrum of symptomatology. In Ayurveda, disease has not been singly explained, means the separate disease is not explained for the CKD, but it is having the references of its clinical features, which is depicted in multiple disease presentations. Mutra dosha is one such clinical entity which could encompass all the diseases of the kidney. In ancient times, since biometric evaluations were absent, so clinical presentation were considered as a red flag signs to diagnose the anukta vyadis. So, but in present scenario, there is very vast armamentarium of biochemical tests, including blood, urine, and clearance tests, which are helpful in early identification, proper assessing of the course. So that is prognosis of the illness and response to the treatment. So in present scenario, the technologies have improved and many technologies have been updated so to monitor the prognosis, course, and progression of the disease, and also response to the treatment can be monitored. In Western medicine, the initial presentation of the disease have been described with usual ambiguity, and usually misdiagnosis is frequently encountered. So diagnosis of CKD in initial stages needs further clinical assessments and scientific documentation of signs and symptoms. So always the patient follow-up will be done regularly, and the clinical assessment should be done regularly. In Vikara Prakriti, the clinical presentation of patient can be Mutrokasada, that is anuria, Mutrakshaya, oliguria, Shota, renal edema, Asadhya Pandu, that is advanced stage of anemia, and these all Sannipataja Chardi, uremic vomiting, Mutrokasada, which occurs due to avarana by pitta or kapha, which can be correlated to post-infectious glomerular nephritis and diabetic nephropathy. So Mutrakshaya occurs due to secondary illness like systemic hypertension, systemic lupus erythematosus, and hyperuremisis, amyloidosis, pyelonephritis, renal tuberculosis. So these all conditions can be correlated with the Shonitabhishanda, Asadhya Vatarakta, and Amaja conditions, that is Abhyantara Vidradi and Raktaja Mutrakuj. So this kind of clinical differentiation will help us to help us in different levels of understanding the disease and clinical symptoms, etiopathogenesis, and diagnosis. So such tier system will reduce the chances of misdiagnosis by the efficient physician. Thank you for the patient's hearing.
Thank you, ma'am, for your wonderful presentation. Some queries are asked by the participants. Shall we discuss, ma'am?
Yes, sure.
Preventive methods to follow in the kidney diseases.
Yes, the preventive methods. So that is the first and foremost thing. Ayurveda is having vast explanation regarding the Dinacharya, Ritucharya, and the Acharya Rasayana. So most commonly the Rasayanas, which are indicated or which are used day-to-day activities. So in the day-to-day life, we can use some Rasayanas like the Brahmi Rasayana or the Agastya Haritaki Rasayana. So all the Rasayana, so the honey is also used in day-to-day life, and also the Gruta. So all the Rasayanas which are available easily. So Rasayanas is one of the most preventive aspect for the prevention of the the systemic diseases like chronic kidney disease. But still, to be specific, we can go through the CKD, the chronic kidney disease. So preventive aspect is, so that is, we have to maintain the proper functioning of the urinary system. So to maintain the proper functioning of the urinary system, what we have to do? So the electrolyte and water and electrolyte balance. So it is one of the most common preventive aspect. So we have to keep the body hydrated so that to maintain the water and electrolyte balance in the body. So which helps in the maintenance of proper functioning of the urinary system. Second is, so that is the one of the most preventive as important preventive aspect. So in modern science, that is as we move on to the pathological aspect, so that is a solute and water reabsorption. So when there is a water reabsorption takes place properly by the kidney, so then the urine output will be maintained properly. So when there is a water absorption or water reabsorption in the body takes place, so it will helps to maintain the renal profiles. So that is creatine, urea, creatine, and the uric acid. So these levels will be maintained normally. So that is in the body. So that we can prevent the chronic kidney disease by maintaining the water and electrolyte imbalance and the fluid balance in the body. So whether it may be the interstitial fluid or extracellular fluid or intracellular fluid. So as we know the physiological function of the body or genitourinary system. So it is one of the main factors. So that is water and electrolyte imbalance. And second is Nidana Parivarjana, and third is Patya. So there are some Patya and Apatya which are mentioned in the Mutra Krucha and Mutra Gata. So we have to follow that. So by these means we can go for the prevention of the CKD.
Okay, ma'am. Next question. What are the effect of long use of antihypertensive medicines on kidney health?
Yes. So here antihypertensives is also having the property of nephrotoxicity. So here if the patient is not, even though patient is taking antihypertensive, but the blood pressure is not maintained or it is not controlled, then it leads to the pressure on the. So here the high blood pressure will leads to the renal failure. So here also how it is means the antihypertensive medicines is one the having the nephrotoxicity for if it is not administered or if it is not advised properly to the patient. But along with that there is a pathological process, that is atherosclerosis, what we call. So it is having the direct influence for the renal failure. In this, there are three categories: pre-renal causes and intrinsic renal causes, post-renal causes, and pre-renal symptoms. So here in pre-renal causes, what happens? There will be decreased renal blood flow, and that will creates the hypovolemia, and that leads to the atherosclerosis. But when there is the blood pressure is maintained, if it is blood pressure is not maintained, it leads to the atherosclerosis. But when blood pressure is maintained properly, so patient is taking antihypertensive. So if the patient is whether he is taking the calcium channel blockers or the simply the amlodipine, or the patient is taking any sort of antihypertensive, you have to observe like what is the recording of the blood pressure, whether it is progressive or whether it is whether the blood pressure is in control or whether the blood pressure is worsening. So patient may have the complications of the increased blood pressure or accelerated hypertension. So for long use of antihypertensive, what happens? The person will be having direct impact on the circulation. So that is a systemic circulation. So that's why the person may have chances of end up with the kidney disorders.
Okay, ma'am. Next question. What can be done in case of creatine level 10 to 15? Can we treat high creatine level with the Panchakarma procedure?
Yes. So here the eGFR, I told about the eGFR. So in that estimated glomerular filtration rate. So it is calculated based on the age of the person and the creatine level. So if the creatine level is 10 to 15, it is very high. The normal creatine level what we take is as I explained, that is stages of CKD. So here also there is a in a stage 0 to stage 5. So the GFR will be more than 90 in stage 0, but in stage 5 it is less than 15. So it means that if the stage creatine is 10 to 15 means it mimics or it equivalents to stage 3 to 5. So it is very difficult to analyze or to make the treatment protocol when the creatine level is high, because Panchakarma procedure, we have to observe the Rogi Bala also. If the patient is stiff or the physique is good and patient is doing good and there are no any severe symptoms like anemia or the breathlessness or any skin manifestations or urine output. So based by seeing all these parameters, we can go for the Panchakarma treatment. But 10 to 15 creatine level is at the risk of going for the Panchakarma procedure. Better not to advise the Panchakarma procedure if the creatine is more than 8. So it is an ideal parameter. So in few studies in research projects, in the PhD research projects, there is a limitation. So in serum creatine, we have keep the upper limit as a 8, because in the stage 3 to 5, the patient will be having the vomiting, dehydration, and anemia. So these are the very dangerous symptoms which will directly may cause the sudden death of the patient. So it may go for the emergency. So always we will keep the upper limit of the creatine level for Ayurvedic treatment, whether it is Shodhana or Shamana, that is 8. So it is the ideal upper limit for the creatine level to go for the Panchakarma procedure.
Next question, ma'am.
Yes.
Is Nitya Virechana or Sadhya Virechana is preferable?
Yes, obviously, but the classical Virechana is ideal for the Shodhana. So almost if the patient is fit enough or the patient is having the Bala is good or he can tolerate the classical Virechana. So classical Virechana obviously will give Dipana Pachana, Snehapana. So Snehapana is a very tough task in counseling the patient. So if the patient is strong, having the enough strength or enough physique, so if he is tolerable, so you have to counsel the patient for the counseling is very important for the classical Virechana. So even though patient is having good physique and good physical strength, but mentally he is not able to accept the treatment. So in that situation, so Nitya Virechana or Sadhya Virechana can be preferable. But classical Virechana holds good for all the Bahudoshavastha.
Thank you, ma'am, for the discussion. Now I request Dr. Ravi Edvanawar, sir, Professor of Department of Kaya Chikitsa, for the vote of thanks. Over to you, sir.
Okay, thank you. Good afternoon, everyone. Myself, Dr. Ravi Edvanawar, Professor, Department of Kaya Chikitsa, SVM Medical College, ILKAL. So I am very much happy for having an opportunity to propose a vote of thanks for today's session. So it was the first lecture of our national webinar series 2, Manvantara 2022, organized by PG Studies in Kaya Chikitsa of our institutes. So today, Dr. Ashwini Sajjanawar Madam, Assistant Professor, Department of Kaya Chikitsa, DGM Medical College, Gadag, has presented a webinar speech on therapeutic domains of chronic kidney disease in Ayurveda. So the presentation was very nice, interesting, and quite informative. So Madam has been explained in detail regarding the CKD as well as per Ayurveda, as well as according to the modern also. So understanding regarding the CKD is said to be a need of time now, because a lot of lifestyle disorders such as diabetes, obesity are having the much more influence in the onset of chronic kidney diseases, and these obesity and diabetes diseases are said to be having the burning issues in our country nowadays. So Madam's presentation was very wonderful. So on behalf of our management, principal, teaching and non-teaching staff, PG scholars and UG students of our institute, I would like to convey our sincere thanks to Madam. Thank you, Madam. At the same time, I would like to take this opportunity to say our sincere thanks to our management and principals are also for conducting such webinar series. Without them, it was not so easy for conducting the national level webinar series. So thank you, sir. At the same time, I would like to say our sincere thanks to the teaching and non-teaching staff of our college, PG students especially related to the Kaya Chikitsa department, and all the UG scholars and audiences for being actively participation and their support throughout the sessions. So thank you one and all.
Thank you, sir. So I would like to thank the respected principal of Vijay Mantesh Ayurvedic Medical College and Postgraduate Research Center, that is KC Das, sir. I thank all the faculty of Kaya Chikitsa department, Dr. PV Joshi sir, Dr. R.V. Edvanawar sir, Dr. Venkatesh sir, and Dr. Praveen Sajjan sir, and all the PG scholars of Department of Kaya Chikitsa. I thank everyone who supported and gave me opportunity for the Manvantara 2022 National Webinar Series 2. So I thank once again who is directly and indirectly support for this event. Thank you, one and all.
Thank you, ma'am. Thank you, one and all. Now here we will end the session.